Welcome. My name is Susan Casella. I am the Director of Sales with ViaCord. So happy to have you here today with us. Thank you so much for joining. And most importantly, congratulations at this exciting time in your lives. I also want to thank our partnership with Prego Expo for inviting us today. We're excited. July is Cord Blood Awareness Month. So perfect timing to have our presentation, Everything You Need to Know, Planning for Your Family's Future Health with Cord Blood and Cord Tissue Banking. And now on to our agenda. Next. Next slide, please. Great. Today we will discuss what makes the umbilical cord blood special, what is cord blood and tissue banking, how newborn stem cells can be used, the banking process, and pricing. We have an unlimited time special offer we're excited to share with you today for Cord Blood Awareness Month. That will be covered at the end of the presentation, so please be on. I have my colleagues with me today. They are in your chat, Leslie and Jen, so please chat in any questions. And after the presentation, we'll go to our booth if we don't get to what we need. But let me just read a quick disclaimer before we get started. The information provided in this session is for general medical education purposes to aid families in their decision-making process regarding the preservation of newborn stem cells. Banking cord blood does not guarantee that treatment will work, and only a doctor can determine when it can be used. Cord tissue stem cells are not approved for use in treatment, but research is ongoing. Genomic testing services are not for use in diagnostic procedures. The content shall not be used to make a diagnosis or to replace or overrule a healthcare provider's judgment. Next. So, your newborn's cord blood. The umbilical cord, it's a valuable resource, and it provides an abundant source of two different types of cells. We have the tissue cells and the blood cells. Each contains multiple stem cells, but we're going to just focus on the primary type in each. So cord blood has hematopoietic stem cells, and we refer to those as HSCs. And the cord tissue has mesenchymal stem cells. We refer to those as MSCs. These are very different, and that means that they have the ability to help in different ways. So we will cover both in more detail throughout the presentation. But just know your baby's umbilical cord vein carries that blood that sends nutrients to your baby, and it's rich in those HSC stem cells. And the cord tissue, it's surrounded with a Wharton's jelly that protects the vein, and that's loaded with MSC stem cells. Again, very different. And keep in mind that both of these are master cells. A stem cell is your master cell in your body. Sometimes we refer to it as a biological toolkit. Next. So what is cord blood banking? It's very simple. It's where you collect and store the stem cells from your newborn's umbilical cord for your family and for potential future medical use if needed. Please know it's safe and painless, can be used in any birth plan, can be used during delayed cord clamping if you wish. We get that question a lot. Can be used for C-section and does not interfere with the birthing process. Next. So cord blood. Next. So let's talk about the proven uses for cord blood stem cells. Today, cord blood stem cells have been used as a source in transplants for over 30 years. There's nearly 80 conditions that can be used for cord blood stem cells in treatment to rebuild a healthy blood and immune system in the patient. And those are certain cancers, blood disorders, bone marrow failure syndromes, metabolic disorders. Most of these conditions on the proven use list are inherited genetic diseases. So in that situation, typically a child with a genetic disease who's in need of a transplant would require cord blood from a sibling or an unrelated donor. However, please note that some conditions on the list, like one in particular is neuroblastoma, it's a cancer, where a child could use his or her own cord blood. So that's proven today. So now let's go to clinical trials, regenerative medicine, we call it sometimes. Regenerative medicine using living cells to potentially regenerate or facilitate repair by stimulating the body's natural self-healing mechanism. Regenerative medicine is an advancing and a very exciting field. There's a lot of research interest going on, but please know not all proposed indications have FDA approval or are considered standard of care today. But many ViaCord families have had the chance to participate in these regenerative medicine trials because they had their banked cord blood for certain conditions and they had access to either their child's or their siblings. And what are we looking at for that? That's like brain injury, cerebral palsy, celiac, autoimmune like lupus. Again, very different from the blood disorders where you're using the cord blood and transplant. This is regenerative medicine, infusions. And next, we have newborn DNA genetic health insights. This is where, unlike other banks, ViaCord can mine through the data, your baby's cord blood's DNA, and take a very small sample of the cord blood, and it provides us with useful genetic health insights to support your child's health journey. So families banking cord blood have these additional genetic tests providing insights. And what are we looking at with those genetic tests? We look at their predisposition to celiac disease or lactose intolerance, potentially some inherited cancers, some medication sensitivities. So please know that ViaCord is the only bank currently using the baby's cord blood to see these genetic health insights. So really exciting. Next, please. Who can use your baby's cord blood? We get this question a lot. There are specific factors that determine who may be able to use the cells. These are medical conditions being treated. What is your condition? It also depends on the availability of a compatible match, very important. But ultimately, it is always the treating physician who will make the final decision. But just know your baby's cord blood is 100% match to themselves. They may be able to use his or her own cord blood in treatment in certain non-genetic diseases and cancers. And in regenerative medicine, they can. It is if it's a genetic disease we're looking for a transplant, the next best treatment option is always the sibling. That's why it's really important to store each child in the family. So the siblings are up to a 75% match. So that is, very good to know. High matching potential. Next slide. So how are ViaCord families using their cord blood? You could see here that over 600 families have called for their unit for transplant or regenerative medicine. So over 600 families have called their unit. So on the left, we see the stem cell transplant numbers, close to 300 releases as of 2024 for those blood disorders that we talked about. You see listed under there. On the right, regenerative medicine indications. We see 321 releases as of 2024, and those are for not the blood disorders, right? For the brain injury, the autoimmune, and the other. So it's really interesting to see if you look underneath on the stem cell side, the families, the 348 releases as of 2024 were sibling to sibling. They were genetic in nature, so they had the siblings' cord blood for transplantation. And on the left, for regenerative medicine, there were the 273 used for self. That child used their own cord blood for these regenerative clinical trials to hopefully see improvement in their quality of life. And really good to see the turnaround time. You can see here the age range of samples. We have ranging from 7 days, and this was a sibling to a sibling for a transplant for a leukemia. And then we have 19-year-old that was released by ViaCord, and that was again a sibling to a sibling, but it was for cerebral palsy, not a blood disorder. So really nice to know that whether it's stored for days or decades, you can use these samples. And I do want to say that, banking cord blood is never a guarantee. It is just giving you options for treatment, and it is always up to your treating physician. Next slide, please. So now we're going to share Patrick's story. This is a family, the Rooney family, and we've just covered a lot of statistics that are very important to help you make a decision. But what's equally as important is the power these stem cells can have to a family. I've been fortunate to meet the Rooney family. The father's a police officer, the mom's a stay-at-home mom. And I just want to give credit to their OBGYN who educated them many years ago, and they banked for each child, never thinking they would need it. Play the video, please.
My first pregnancy was Patrick. He was adorable, so cute.
Patrick was, no complications. Patrick was fine.
We banked Patrick's cord blood with ViaCord, never thinking that we would need it.
It's one of those things, you'd rather, like insurance, you'd rather have it and not use it than not have it and need it.
It was something that we felt was important, but something we never thought we would ever need to use.
Then we start noticing things. He's crawling funny when he's drinking his bottle. He would hold it with his right, and then his left paw, his left hand wasn't holding it. It was just like a fist, like this.
He fell a lot when he started walking. And we also noticed when he would stand, his left leg would turn in. So then now he goes into pre-K, and the teacher says, oh, they can't understand him, so they kind of walk away from him. And I was like, oh, nobody's playing with him, She also said that he couldn't cut with the scissor. He was tripping a lot in the classroom. He can't open up his snack. He can't put the straw in the juice box or open the straw. We made an appointment for a neurologist, and she said cerebral palsy. We didn't get the official diagnosis until we got his MRI. That's when it confirmed that he had a stroke in utero, and there was damage on the right side of his brain that affected his balance, coordination, motor planning.
So me and my wife were like, and I don't want to believe it, About a year later, got contacted by ViaCord, and that's when, the shot heard around the world. That's when it changed our life.
We would get notices in the mail. This time I opened it, and it said that Duke was doing a study for cerebral palsy using the child's own cord blood. And it made me think, well, if it lessens his struggles just a little, it's worth it.
And if this is your child, you got to do everything you can for your child. That was my motivation for going, just so, I could look him in the eye when he's a man and say, we did everything we could for you.
The changes after his infusions, physical therapy-wise, he could do jumping jacks, jump rope, which is something that he couldn't do.
He can ride his bike now with confidence. His left foot always used to be perpendicular to his right, and now they're perfectly straight.
When he was younger, he couldn't run because he would trip and fall, and now he's running races and winning.
I can keep up with everybody, and I can play. And I don't get tired when I get home from school anymore.
I think his future is limitless. I think he could do whatever he wants. He's definitely going in the right path, and it's a wonderful feeling.
We were so grateful that we had Patrick's cord blood to give him because he's like a different kid today. He's like unstoppable.
Okay, thank you. Next. Okay, so let's talk about cord blood. Oh, and let me just backtrack to say, just to be clear, Patrick used his own cord blood to get in that clinical trial. So Cord Blood and Genetic Health Insights, families banking cord blood with ViaCord, are also choosing to access early and useful genetic health insights to support their child's health journey. This is easy. We take a small sample of the cord blood and we isolate it during the banking process. So let's just go over quickly the genetic tests available. We have whole genome sequencing. We analyze 2,500 genes with known associations to childhood onset conditions and drug sensitivities. We have a retrospective study you see under there from the Journal of American Medical Association. It found that 1 in 12 apparently healthy newborns who used ViaCord's whole genome sequencing carried genetic findings that could impact their health from an early age. So 47% of these findings were associated with health conditions that could benefit from early intervention and medical management. So they were seemingly healthy, but we found things with the whole genome. Genetic Insight Panel, it's smaller panel. They identify actionable childhood onset conditions with 290 genes. We have our newborn digestive health. This provides genetic insights early for you to see a child's predisposition. I'm sure you're familiar with celiac disease and primary lactose intolerance. And then Newborn DNA Guardian. This is the DNA found in that umbilical cord cell. For genomic testing in the future, we take a small sample, we store it in our lab. It's a unique option to preserve a sample of the child's DNA that's pristine at birth before exposure to the environmental factors that could impact everyone's DNA. And you can use this and reanalyze it for future testing. So all of these combined, they're convenient, they're proactive, they empower early intervention, they enable a personalized health plan, and they don't impact the cells anyway. Next, please. So, cord tissue, next. How can cord tissue be used? In clinical trials, right, for regenerative medicine, there are over 350 clinical trials going on worldwide right now using those MSCs, those mesenchymal cells. And the examples are autoimmune deficiencies, arthritis, Parkinson's, again, different from the blood disorders. This isn't a stem cell transplant. These are infusions. And the potential is these researchers are excited about this cord tissue MSCs to help conditions that affect cartilage, muscle, and nerve, addressing conditions that cord blood stem cells cannot. And it's preparing you for possibilities. You know, although there's no proven uses yet, banking the cord tissue now. So you're delivering now, you know it's proven with the stem cell transplants. Now you're seeing what the future shows, and you have to make that decision now because you can't go back, right? After delivery, those cord tissue stem cells are medical waste. So it's preparing you for the future. Next slide, please. So cord tissue banking, it does make a difference, right? When it comes to cord tissue banking, it's important to understand that the process varies among different cord tissue services. I believe what we do speaks to our commitment to science and innovation, and importantly, putting families in the best position possible early on. We saw the potential in cord tissue and invested in a processing that extracts the cells prior to freezing them. Other banks will freeze the cord whole or chunk it. It's so important to know that ViaCord's lab is the only family bank accredited by the American Association of Blood Banks for processing and storing newborn stem cells from cord tissue. And our method does result in 8 times more number of cord tissue cells. Again, you see there in the bottom, ViaCord's the only family bank accredited for both blood and tissue by the AABB. Next, please. So why ViaCord? Why are families putting their trust in us and healthcare providers putting their trust in us? Next. What we offer, 30 years of cord blood banking experience for hundreds of families. We have established quality with over 600 families who have used their bank cord blood in a stem cell transplant or regenerative medicine. Trust. We are that only family bank accredited, like I said before, by the AABB for processing and storing both cord blood and cord tissue. So important. You get more from your cord blood with ViaCord. Only ViaCord harnesses the power of that cord blood and that pristine DNA I talked about that unlocks the genetic health of your baby, and you have early insights for early intervention. We're recommended by healthcare providers who feel good knowing their patients are in good hands, and the stability of our company. We are supported by experts with our parent company, Revity. They're a nearly $3 billion global health leader in diagnostics and life sciences. Next, please. So just to be clear, what are our services? You have flexibility. You can pick the plan that works for you. Cord blood banking from your umbilical cord. You can add on the cord tissue, collect and save your newborn's cord tissue along with the blood. And now the DNA Health Insights. Add genetic health insights to test your cord blood services. You have to have the cord blood stored in order to get the DNA Health Insights. And what do parents love about this? You pick your options. You know, you can lock in. We have I'm going to talk next about our July summer cyber sale. You lock in, but you don't pay a penny, nothing, a deposit until after delivery. So you pick your option, pay nothing till the baby's born, which I will go over. Next, please. How does the banking work? It's so simple. Online, you can enroll in the service to get your kit or over the phone with our team. Your collection kit is sent to your home, very easy. You bring it to the hospital on the day of the delivery and you give it to your healthcare professional, either your L&D nurse, your OB, or a midwife. Once it's collected, they hand it to the support person to call ViaCord. The number's on the outside of the kit. Courier comes to your hospital bedside or to your hospital, pick it up. They transport it to our processing lab and you'll be notified when it arrives at the lab. Next, please. And our processing lab, like I mentioned, please have comfort in knowing we do everything to protect it every step of the way. We are accredited by the ABBB, like I said. We operate 7 days a week, 365 days a year. We're centrally located right outside of the Cincinnati, Ohio airport. We're registered. We have hundreds of thousands of stem cell units processed and stored. We use the same freezers as the NIH. We're FEMA grade class storage vault, and we always protecting our samples. Next, please. I'll just go over pricing quickly. We have our special cyber summer event, which is good until it expires on 7/31, but you're only locking in this savings. It's our best pricing of the year. If you choose to enroll before 7/31, you will get cord blood and cord tissue at a discounted price for $1,360. That's a one-time payment. You pay after delivery. You could pay it in full or break it up in a payment option. You see a 12-month plan is $124 a month for 12 months. And then it's just once a year annual storage starting at the baby's first birthday, $370, second birthday, $370. Cord blood is now $685 discounted. Again, first year all in, $685. After the first year, you begin paying the annual storage, which is $185 once a year. So great savings available through 7/31, but nothing until after delivery. We're going to do Q&A in our booth. Last slide, please. After Q&A, just please stop by our booth, say hi. We'd love to connect with you. We're here at www.viacord.com or call us anytime. And congratulations. Last slide. Thank you and congratulations to everyone. And we'll see you at the booth. Take care.